Majority of the patients who come for treatment of infertility conceive with simple treatments like ovarian induction and IUI. Some of them still do not conceive after undergoing simple treatment. These three people need to undergo IVF. IVF is a more difficult kind of procedure, but at the end of the tunnel there is a ray of hope, and a lot of people ultimately will achieve success with IVF as well. Where there is a will, there is always a way. So IVF is a long drawn out procedure, and it is very important to psychologically and mentally adjust yourself to this procedure. One of the most important things is to get a lot of information as to what exactly you are going to undergo. You need to talk with the doctor, you need to talk with the staff in the clinic, just like nurses or counselors or paramedical staff, other doctors. You also need to chat with your people who in your workplace, because a lot of educated people are there, your friends are there, you can connect with them. And most important of all is that you need to access the internet. Internet has got a huge amount of information. There are a lot of websites that are there which can give you a lot of information about infertility in general and IVF in particular. And there is also this fantastic website called parentsforfertility.com, which is very important site to access information. It is very important to plan the timing of your IVF cycle. Sometimes you are going out for a holiday or there is some other important commitment you have. It's best not to have anything during the main part of the cycle. It's also very important to plan when you would like to have the results. So many times the result may be positive, sometimes it may be negative. So it's very important to see that you receive the result at a good time and a good place. Especially it may not be that great to receive a result when you are in your office at work. So it's very important to also get some degree of support from some support groups. There are a huge amount. Many of the IVF clinics have their own support groups, or you can join an independent support group, which will give you a lot of mental strength to face the whole difficult task of going through the whole cycle. It is very important to see that if you are undergoing repeated cycles, there should be enough time for you to recuperate mentally and physically before you take the next cycle. And it's also very important not to say too many things to people around you. Unnecessarily they'll ask you too many questions and you will get distracted from the main objective of getting a successful pregnancy through IVF. Work-life balance is very important aspect of IVF. You should not allow the stress to take over your whole life. You should internalize the stress and come out victorious at the end of this whole procedure. When you are undergoing IVF, there may be negative and positive thoughts. It's very important to emphasize on the positive aspects of the outcome. It doesn't mean that all the time you think positively, but it's important to try and find out which are the best things that will really help you in achieving your outcome. You need to talk to the counselors. You need to also adhere to certain points which I'm going to tell you now, which will help you to get a better outcome at the end of the procedure. One of the ways to cope through IVF is the positive reappraisal technique. For example, focus on the benefits rather than the disadvantages. IVF is trying to get me better fitness, better health, and it's trying to get me closer to my partner. These should be the thoughts which you should have when you are undergoing the treatment. Try to think more about the positive things in your life. For example, by undergoing IVF, I have been able to manage my time better. I am more efficient in my workplace. I am going to be better in my outcome. Try to do something more meaningful, such as indulging in a hobby that will make you much more happier. Manage your time much more efficiently. You can analyze your own emotions and come to terms with them. And not only that, you can also have better relationship with your partner. Try to do something that makes you feel positive, such as reading a book at home or walking the dog, talking to your friend, going on the internet and indulging in social media, anything that distracts your mind and makes you happy. So in our country, when a patient comes from IVF, there are a lot of challenges, especially of course our country has got financial challenges. Then I come across a lot of patients who have failed multiple times. So these are the patients which really need a lot of counseling, lot of understanding about the technique. Many of the times I feel that they are not been counseled about the pregnancy rates properly. You have to understand that the chance of pregnancy is 1 in 3. Every time 3 patients undergo IVF, 1 will take a live baby home. And once you understand that, then you are much more relaxed. If on the top of it, you are counseled well about it. And as I've told you, you apply the positive reappraisal technique to this whole scenario, then you will definitely not only have a peaceful journey of IVF, but you will also achieve a positive pregnancy at the end of the journey. There is always a pot of gold at the end of the rainbow. So IVF is just like any other problem. Like if you have got a fracture, you will go to the doctor and get it corrected, put a cast in. Similarly, if you don't have a child, you go to the doctor, get treated, and at the end of the treatment, anyway, 99% of the time you are going to achieve a pregnancy. The only difference between IVF and other lines is that the failure is higher, so you need more cycles to achieve that pregnancy. Also, there is no social stigma in IVF. It's just like any other problem, and you should look at it in a very positive way. And once you do that, you will achieve the goal of a pregnancy. Ultimately, लोगों का काम है कहना.